And there we go. So yeah, Alessandra, you were telling, what did you do with that small list of questioning, and what do you think came out of it?
Well, that at first you were focusing on the thought that it was very dangerous, very scary to go outside. And then when you analyzed the evidence for and against that thought, you came up with a more functional thought, which
Hmm.
is if I go for a jog and I take my precautions and I keep social distance, it's probably okay.
Hmm.
So
Yeah,
I'd like to think that that would lead to your level of anxiety lowering.
yeah, yeah, yeah. Absolutely, absolutely. So I think, and people on the call, you can look up after this call as well, right? The Socratic questioning approach is more of first analyzing your thought itself to understand what you are really thinking, because sometimes we don't even know what we are thinking. What are we stuck on? What is making us anxious, right? There is only an what if as a question, but nothing beyond it. And it's not even a reality, for example, not even as real as this case. Then we try and evaluate it a little more deeper and then ask
Mm-hmm.
questions, right? Because if it is catastrophizing mindset, as I said, it's only about what if. For example, I'm a teenager, I have a girlfriend, everything is good, but I'm just, what if she leaves me, what if she dumps me, and just that's it. Beyond that, I don't think anything. And you try doing coaching to that person and you will know how hard it is,
Mm-hmm.
right? What if she leaves me? And generally the problem with specifically this distortion, as I was trying to say, is we are not thinking beyond what if at all. What if everybody gets coronavirus and die, and what if coronavirus comes at my place, or what if my daughter falls from the monkey bar and breaks her leg? Well, what if, right? First,
Mm-hmm.
are there different possible outcomes? We need to think about that. So as
Mm-hmm.
Alessandra as a coach made me think about different options, that in itself brings down my anxiety, right? Again, let's be very clear. I'm not trying to say there is no problem. What I'm trying to do is, what we are trying to tell is that problem need not build up anxiety and stress so much that it becomes bigger than the problem, right? So we are trying to control our stress and anxiety around it. That's the main point. So first is, are there really different options? Are there proof points enough for what we are thinking to come true, or is it a black and white other distortion of thinking, etc.? So it helps us classify our thoughts better, and with that classification there is already a non-association with the thoughts. There is a space created, brings down my anxiety level. But then in some cases you really have to challenge the worst case outcome. What if that really happens? What will happen 2 weeks down the line from there? What will happen 1 year down the line? What will happen 5 years down the lane? Is it still going to be of matter, right? And then from there we need to continue thinking about things, right? uh, One of the examples what I had is from within our office itself. There was this guy who had an so-called an anxiety attack, and he shouted in office and then he left. He was treated and then he wanted to come back. Now he is catastrophizing in a sense that, oh, everybody saw me behave crazy, in his head, right? And now people are going to look at me differently, people are going to treat me differently. And here I can't ask him to, oh, do you have proof points, or what are the other alternatives? Even I know this is going to happen with him when he joins the office. So I start with the point that, yes, what if that happens? Let's think beyond it now. Yes, it will happen. Let's think beyond it. What if it happens? The week one, maybe everybody's going to keep a little distance with you. Somebody's going to try to be over empathetic with you. People are going to stare at you. Week two, maybe 20-30% of people whom you have really closely worked with, they are going to start getting normal. They're going to crack jokes about it. You are going to start cracking jokes about your own self. It's going to get comfortable. 3 weeks down the line, I think people would have moved on from really those things to working the day-to-day things in office. Everybody has too much work on their hand. Everybody is going to get much practical. And maybe even 5 years down the line, some people are really going to stare at you, but similar way that you are staring at some other people for their past and talking about those things. It's really not going to matter eventually, and you have to see through that. And he's saying, yeah,
Mm-hmm.
you know what, you are right, and that's what's going to happen. And yeah, now I need to plan out what I need to do with it, rather than, oh, what if, oh, this is going to happen with me, and what if people what if people stare at you, what's going to happen, what's the worst thing that will happen beyond it? The phase will move on, you will move on, right? So that's the point, that catastrophizing has this three things: evaluation, go beyond what if with logics and break up with different possibilities, or finally hit, and it's very counterintuitive, finally talk about what if that worst case scenario happens, what's going to
Mm-hmm.
happen 1 week, 3 week, 1 year, 2 year, 5 years down
Mm-hmm.
the line, and then let's work around that, right? So these are the different approaches around
Mm-hmm.
catastrophizing, mindset challenging, using CBT. Yeah.
Exactly.
Anything anybody wants to add on this? Any impulses, any thoughts that are going in your head that you want to share with the group? Yes, Pilar.
Well, I'm like a little kid with my with my little
Pidiendo la palabra.
teacher. May I?
I'm sure you're making your
Teacher.
kids do that when they
Of
want to ask
course
the
not.
Oh.
question.
They don't do that. I wish they would. Well, I
Yeah.
was thinking about this case of this man in the office and what happened, and it's very difficult to develop confidence after you do something. Ay, Dios bendito. After you do something where you lose control,
Yes.
you feel you lose credibility, and the
Yes.
credibility you first lose to you,
Yes.
and then you lose to the other people.
Yes.
So thinking about what is this space I am in, because
Yes.
I mean, Monse was with me in class, and I told jokes and I laughed and I lost composure and I said, gotta go, and I went to the bathroom and back. I mean, things that happen when because you're alive,
Yes.
and the things are as important as you make them.
Yes.
And keeping professional
Yes.
can be in the same space of keeping human.
Yes. Yes. Yes.
So if somebody is giving you hell in your work,
Yes.
you can always act like an actress here who was a very proud woman. Her name is Maria Felix, and
Mm.
she would do, you know, the eyebrow and look over the eye, and I thought this was professional.
Yeah.
I thought you were a professional. How
Yeah.
can you come and talk to me like that? You know, and Alessandra is imagining this woman with her voice and her voice and her blah
With her
blah
very
blah blah
deep,
blah.
manly
But
voice
I thought you were professional. Actually, I thought we were
and
even
her
friends, and you
killer
come to me
looks.
with this attack. How do you feel about yourself?
Yeah.
And you turned it on the other one. I'm good with guilt because I was a born Catholic,
Yeah.
so I know how to work as a weapon.
Good old
But
Catholic
sometimes
guilt.
to defend yourself, you must.
Yeah. Yeah.
I
Absolutely.
don't know if anybody else has a different insight, but you have to work your human and your professional and go through the things. As Alessandra and you were going with the ball, you know, the question, the answer, the question, the answer. I was thinking, how would I have done this?
Yeah.
How would I have uh, used information that is very sensible information without making the person crazy? I thought,
Yeah.
okay, this person likes statistics and numbers, so let's do that. And then I said, no, it's going to backfire. It's
Yeah.
going to backfire.
Yeah.
That that is not, because you are not convincing the mind, you are convincing the soul.
Yeah. Yeah.
The mind can go with many other things. For example, my husband, who's a scientist, he's studying that in many people think that there is a correlation between the tuberculosis vaccine, the
Mm-hmm.
consumption vaccine,
Mm-hmm.
and the kids that present no syndrome, no symptoms.
Mm.
Apparently, all the kids who have that vaccine have been clear. I And it's like, oh my God, oh my God, what is happened? A bacteria that has to do with a virus, and it's all very fascinating for him. I don't understand it,
Yeah.
but I find it curious.
Yeah.
But they're still testing, so you cannot offer that. For you go get a vaccine on tuberculosis, or you got it, then you're immune. It's not as easy, and
Yeah.
you have to talk to the heart. You don't have to talk to the mind.
Yeah.
The mind is crazy.
Yeah.
The mind needs a leash, and the leash of the mind is the heart. It has always been. That's why we fall in love with stupid people sometimes, uh, because the heart was so
Yeah.
leash to the mind. So if we keep that in mind, and we talk to the heart of the person, and we think about uh, what does this person really needs. The person doesn't need information. The person needs hope. The person needs love. The person needs comfort. The person needs um, to know that it's going to be all right. Yes, it is a mess, but you're doing what's right, and doing what's right is the best you can do. So you're doing everything you can. So you are among the hopeful people who are going to get it right.
Yeah.
So
Yeah.
you're going to the heart. You are reassuring the things that the person was doing that were right. And I guess that was the key point that Alessandra was aiming to.
Yeah.
Are you doing this right? Yeah, then you're okay. You're going to be fine. Reassuring
Yeah.
with the catastrophizing, because when you catastrophize, it's like you said, Jemin, you don't think.
Yeah. It's
You
more
hit
of
a
feeling.
wall.
Yeah. Yeah. Yeah.
You hit a wall, and it's the end.
Yeah.
But what if it's not the end? It is the end. I know it is. No, it's not.
Yeah.
There's going to be a next minute, and a next hour, and a next day.
Yeah.
And
Yeah.
that's all I want to say. Thank you.
Yeah. Thank you. Thank you, Pilar. Anybody else on the phone? Raj, Nirmal, Montserrat, you can always chat if you want to send some insights.
An emoji, Monse.
All righty. Okay. Then, yeah, I feel better listening to you. Good. Good. All right. All right.
Okay.
At least you are there. You have not ran away with this three crazy people talking about some things. Um, um, just one last word of caution from my side, right? And let me actually start a whiteboard, because that brings me to the next session already of going into the mindfulness talks. Um, so let me know once you can see the whiteboard.
I think I'm seeing just white and a few icons.
Yeah, this, right? I scribbled.
Yes, I saw your
Scribbling. All right, perfect.
scribbles.
So
Yes.
what I wanted to tell is the following. Just give me 1 minute. Um, yeah, okay, so my daughter is up. um, so what I was trying to tell is a word of caution. um, I have some friends whom when they are catastrophizing and I start talking already about hopes. Oh, this will pass away. They hate it. They're like, why are you so positive? I just hate you for that. I mean, the world is crashing on me, right? So advising, guiding, and counseling, right? The counseling is always about the person understanding and coming up with that hope, or yes, there this movement will pass away from within themselves. We can't tell them, right? So sometimes positive reinforcements goes negative way, because the person is so bucked down by their reality of feeling that anything you put positive only in contrast brings out their negative feeling within themselves more. They're like, oh, I understand the way you think and I love it and wish I could think like that, and oh, I'm not even like that, right? And I'm the worst, and they go down, right? Also about facts. Sometimes even the facts backfire. For example, people are labeling, oh, I'm a loser in my life. Everything that I do, I fail. And you're saying, but do you have proof for it? Are there quantifiable? And you say, yeah, I failed in my 12th exam 3 times. I couldn't get my job even after 5 tries. I couldn't get into university after 10 times. And now as a coach or a person who wants to help, you're thinking, okay, this person has real valid proof points and statistics to tell they're losers. And now what do you do with that? All right. So what I'm trying to tell is a word of caution. Be very careful in not using any golden bullet concepts and not enter into advising and guiding mode. That can really, really backfire. The biggest difference between coaching, advising, and guiding is this, right? So coaching, you can only ask nudging questions and wait patiently for that answer that you know or want the other person to come up with from their own heart and mind. And sometimes they will come up with an answer which does not comply to your cognitive thinking. But if it helps them reduce their stress or achieve their mental goal, that's the right answer. That's really the right answer, right? So this is just a word of caution in terms of people who want to use this concepts on themselves and others. Just a word of caution. And that brings me to today's two very quick concepts around. First, I start with one of the CBT concepts and then get into mindfulness. So the key balance to what Pilar was saying, and that is what struck me and I wanted to talk about it, is what we have as a wise mind concept. We want to bring ourselves and people whom we want to help into this wise mind concept. And what is the wise mind? A wise mind is a good overlap between my emotional mind or my human self, right, and my practical mind or my thinking mind or my, oh, you need to be professional, as you said, right? So this is the place that we want to be. Because if we go too much on this side, right, this is also bad, because here is where the person loses their touch with their own emotions, which is inherent part of every human mind, right? And then there is really no emotions. That backfires as well, and that has its own distortions and so-called mental and physical illnesses. If somebody is too much on this side, yeah, all the biases, catastrophizing, anxiety, depression, never performing the work, never looking at the world practical mind, it's always emotional lens, right? Which is wrong, because then you cannot perform in the practical genre of life. So we need to find within ourselves and within the people the wise mind gap, which is using still the right emotion, where, you know, I'm a professional, I'm doing coaching, but if somebody stands up and slaps me, I have rights to be angry. It's fine to be angry. It's fine to think about worst case scenarios. It's fine to be depressed for some time, but not to an extent where it takes us to this side of the world, right? Whereas it's really important to be practical, sometimes keep pragmatic things over emotional things, take tough decisions. I mean, my daughter really wants to play with me. She doesn't want me to go to the office, but today I have to go to my office, right? But I shouldn't be biased so much towards that I never take a vacation out for her and I only focus on my career. I don't want to be on the other extreme as well. So this is what we want to achieve for people, mindset, right? Be in the wise mindset. Do we have right amount of emotional and pragmatic mix? Especially for people in corporate world, they think they're getting pushed towards this side more and more and more, right, to climb the hierarchy ladder, etc., and this is how you achieve it. But not necessarily. If you really look at good leaders, they are playing in this wise mind, and that's the differentiator that they have. Then maybe how do I clear this? I don't know. Okay. So eraser. Yeah, there we go. And now I want to talk about very quickly, in continuation to the last time of mindfulness. So last time we spoke about mindfulness practice called being non-judgmental towards your thoughts. So seeing the thoughts, even if a catastrophic thought comes, can I just see it without classifying it as good and bad? Easier said than done. Easier said than done. So for that, there are two things which I wanted to bring from a mindfulness perspective as a practice for you guys to try on your own and see if that experience changes. So we feel something. Okay, I need to go to drawing the, or yeah, we feel something and then we think something, right? And from a psychology standpoint, it's generally the thinking that triggers the feeling, but the chain that we have is cyclic in nature. So I feel something bad, or let's start, I think, oh, this is going to lead into a lot of coronavirus spread. Now I'm feeling very bad, I'm feeling scared. Because of that scare, I will have even worse feelings. Because of that even worse feeling, I feel even more bad, and then there is the cyclic whirlpool, right? So the key really over here is to make sure that we break this cycle somehow, right? So to break this cycle, the controlling element that we have is thoughts. And so I need to see this cyclic thing happening within me first. And then at one of these thoughts, I say, okay, stop. Really, really stop. I don't want to think. I don't want to feed my feeling further thoughts. I'll look at my feelings. I don't want distraction. I don't want anything else. I don't want to run away from my feelings. Let it be there. I see where it's feeling physically, for example, but I don't feed it further thoughts. And maybe that breaks this entire cycle. But this is something that you really need to work on your own. And if that cycle breaks, you might have that disconnect or non-identification, even with your thoughts, to then start seeing them as non-judgmental. Maybe not before that, right? Because it's, I mean, how can I be non-judgmental about thinking that my daughter's leg will break? It is a bad thought. How can I tell it's a neutral thought, right? But I need to stop thinking and create that space. So that brings me to that mindfulness point, and then I open up for discussion and get your insights into this. So mindfulness, we need to anchor. To stop our thoughts, we need to have some kind of anchoring, right? So the anchor could be breath. That's the most common thing, but some people find it difficult. So when, for example, if some people have told me that if they start focusing on their breath, how it's coming in and how it's going down, it's not a normal breathing anymore. They find it difficulty in breathing itself, because now they are consciously breathing. They think if they don't think about it, their breath is going to stop. So sometimes the anchor doesn't help that way. So we have to find different anchors. Or there is one other approach which works for some people, and I'll just sound it out a little more philosophical maybe, but practice it, and if it works, it is about look at the looker, or see who is seeing the things, right? Or see who is thinking it, right? So for example, if you just close your eyes, you see different shades of colors and they keep changing, etc., based on lights outside, and that's your eye, which is closed, right, peacefully. But within that thought process, you see who is seeing. So now there is 3 levels of things, right? So if there are thoughts, for example, your thoughts, you close your eyes and see or hear your thoughts based on the kind of person you are, visual or auditory. You can either see or hear your thoughts, right? But then you ask yourself, who is seeing and hearing this, right? In my experience, and I've got it confirmed from few people, when you do that, at least one thing that happens immediately is there is a non-identification between what you are seeing or thinking with the state who is trying to see the seer. So there is a real, you step behind the waterfall analogy that I was telling last time. When you're under the waterfall, there is too much of water, you can't think. And anybody telling you any of this thing, CBT, etc., you will say, oh, you don't know my situation. What are you talking about? But once that person is behind the waterfall, now there is space for us to think more pragmatically, and whichever option works, right? So this is just one of the mindfulness practice and impulse that I wanted to leave you with. Either have an anchor could be your breath, anchor could be try to feel your palm without touching it, etc., and you have different anchors like that. And if you are not a person who can really find a strong anchor, try to see the seer or try to see the thinker, right? And that helps you create that space sometimes. So that's my input on the mindfulness impulse for you guys to try that and see if it helps you. And with that, I think I stop sharing my screen and call out for um, experiences, feedbacks, thoughts that came across while you heard all of these things. I think Montserrat had a very important point on the chat. She's like, I don't like not feeling in control of things, but who is really in control, right? I mean, that's a beautiful thought. I mean, we all want to be in control. And again, bringing back to my analogy of wise mind, that's more of pragmatic thing, right? But we are not machines, we feel, right? But the point really is to even define what control is. Do you want to control yourself like a machine? Do you want to control yourself like a human? Which means it's okay if I got angry, as long as I can move on eventually and still be myself, right? It's okay for that outburst one day to eat a chocolate pie when I'm on dieting, but then can I exercise enough and burn that calories eventually, right? So what is the gamut of control? No, you can't. And it's okay if I don't, because how does it matter 3 weeks down the line, 1 year down the line? Does it really, are you going to still feel as bad as you feel when you land up eating a choco pie right now, right? So an emotional mind versus, so can we stick into the wise mind and allow ourselves to flow like a human? I think that's a control for me, rather than being in control as a machine, right? So Montserrat, to your point from chat, I look at control very, very differently. I'm okay if I be angry. I don't want to be in a control where I'll never be angry. No, I'm a human and I can be angry, which is fine. As long as it doesn't control me and take over my entire life, right? That's a distortion that I need to work through.
Yeah, but I mean, I'm working now as part of my personal search and practice with my Dr. Jekyll and my Mr. Hyde. The Mr. Hyde that is the one that does the things I don't want to do.
Yes.
So my trigger word is hide. So whenever I'm feeling something uncomfortable, whenever I know I'm not supposed to do this, I try.
Yes.
To say, hide, stop it. Stop right there, hide. I am not as successful as I wish. But the idea that of the little times that it has happened, it's been like a month. I mean, I haven't really, I don't know if I'm going to end up bipolar or something. If that happens, well, go visit to me in the asylum and bring chocolate pie, obviously.
Yes.
And but in the meantime, the trigger word or the clue word, the hide, you know, hide works because it's small, it's precise, it really shows the the aspect or the issue that is coming. It's like catching yourself when you're trying to correct something, like when you're learning to write and suddenly they say no, it is to the left, it's not to the right, and no, it's to the left. Yeah, I remember now the way to draw it. Or when you play an instrument that you have to be very precise where you put your fingers, how you move the strings or how you blow the flute or whatever it is, the instrument. And when you are learning for the first time to play the I'm going to say the flute because here in Mexico they ask us to learn to know a number of tunes in the flute in basic music class.
The recorder.
And the idea is that you in the first class you don't judge yourself because we all sound horrible. Nobody knows how to blow the damn thing. It's carrito camotero. That's what carrito camotero. It's a when you come to Mexico, you'll understand what a carrito camotero is.
Sure.
They make horrible noise when they come through, and they have a pipe of steam, and the sound is bone chilling.
It's a horrible sound. Here comes the
You
people
feel
with
all
their
the ghosts
cars.
from hell escape with the carrito camotero. But the first time that you blow the flute and it's terrible, nobody knows, so it's fine. But what happens later on when you start judging yourself, when you start, no, I better not do it because they're going to laugh, and you start with a prejudice, and that prejudice, if you are still learning, how come that some people have ability make you less? So what is going to be your word for I am in a process, and you hide or come here back, stop right there.
Yeah, yeah, yeah,
And
yeah,
the word is, it's let's see what happens. i'm I'm sometimes successful with hide, but let's see what happens.
yeah.
And that's it, because I talk too much.
No, the white wolf, black wolf, the similar story, right? And just give it a practice. And Pilar, maybe next time we talk, remind me to ask you how it worked on it. Again, if you don't judge it, what's what? Is that the way to tame it? Is your
Oh,
judging? If you're judging that this is hide, this is a black wolf, or whatever, this is a demon, is that thought that empowers it to start with? And if you don't judge it, maybe it just tames off, maybe. And second thing is, I think to a point of you are not successful or successful, again, I look, as long as you are trying, that try is success, not the result of that try, right? The day you say, now I cannot try anymore, or I stop trying, that is the day maybe you completely fail, right? So to the point of control, right? As long as we are trying to get better, that's for me the definition of control, because there is some engine which is trying to rectify as we go ahead. Can it rectify as an outcome? That's really not the success criteria according to me. Is that engine still alive within me, who keeps trying to do the course correction? If that is there, that engine is pretty much in control for me. That's trying to put me on the track. So I mean, that's just my 2 cents. Think about it, try to practice it, let me know next time when we meet what happens. Anybody else? Raj, Nirmal, your thoughts? You were first time into this session. Overall, any feedback? How do you think things are going? What are your inputs from this? I mean, we try to keep it a little more pragmatic, scientific, casual, friends of friends talk. So nothing scripted here.
No, this is perfectly fine, Jemin. I've seen your first session, so my expectation was very clear. So
Yeah.
This is going in a perfect format.
All right. Anything that specifically triggered your thought process, Nirmal, that you would try, or you would say, this doesn't work? What are you guys talking about?
Nothing of that sort. So yes, of course, from the coaching perspective, I've understood a little here. Yeah, we should not. One very important point is we should not bring in our perspective or bring in our thought when we're doing the coaching. So that's something I've learned today.
Yeah. We need to be non-judgmental before telling others to be non-judgmental, right? So we need to be
Right.
the
Yeah.
practicing. Sure. Anything from you, Raj? If you are still there.
So Jemin, for me, like, this session is very, very helpful, because as you mentioned, I always take stress to my mind. Anyway, I mean, in many of the situations, what if this happens? What if, how I have to handle things differently? So this is how I always think about things. But I just I mean, what I understand here is I want to look at things differently. I want to think about things from the different perspective on how to handle certain people, how to handle things, and also to practice mindfulness. I want to make sure that I want to live a stress-free life, to make sure that I am having a work-life balance, as well as I take care of my family also. So that is something which I would like to practice. That is the reason I often check with you on how to practice mindfulness, etc. So this is a good initiative, and this is a good start for me. And I hope I will try to practice from my side also. I will dig deeper on this particular piece, and I will try to practice more myself also.
Perfect.
Yeah.
Keep reading the books, and as Pilar said, hopefully none of us land up into bipolar. Otherwise, this would be an interesting session to have. We all could land up there, right? It's the recipe is within all of us. So we'll see. Hopefully, this helps us and makes us more closer to our personal definition of well-being. Is all what I can say. So, any other last thoughts? Any ending thoughts from anyone? Else we terminate the session. Calling once, calling twice. All right then, everyone. Thanks a lot. I will share the.
Thank you.
Just give me 1 minute. Sorry. Just give me 1 minute. I am sharing the feedback link in the chat before the session terminates. Please take some time out and fill up that feedback. It will be off. Oh, I sent a wrong link. I sent the last one. I'm sorry, guys. Just give me and bear with me for a minute more. Okay, the link is coming your way. Please fill this up when you get time, and hopefully we see you on the next session. And please share it with your friends whom you think can get interest or help from such sessions. I will also share the recording with all of you soon. All right, thank you guys. See you. Bye. Stay safe.
Thank you. Bye-bye.
Bye.
Bye.
Thank you
Bye.
so much. Bye-bye.
Thank you, Jemin.
Thanks a lot, Alessandra. Bye.
Bye.
See you next week.
See you next week, hopefully. Bye.